Welcome back to the Medical Entrepreneur IV Chelation Training Series. I'm Adam Sewell, MD, and in this video C2, we're going to cover the exact steps for setting up a chelation service in your clinic. Whether you're expanding your current offerings or launching a brand new service line, this video will give you the practical blueprint for setting up your IV chelation room, building the right team, and streamlining your workflow. To successfully set up an IV chelation service, you'll need 1. A clean, well-equipped infusion space. 2. The right supplies and equipment. 3. A trained clinical team. 4. Systems for patient intake, safety, and scheduling. 5. Protocols and documentation tools. Let's break each of these down step by step. Start by choosing a quiet, clean, and comfortable room within your clinic. Ideally, this room should accommodate at least 2 infusion chairs, a hand washing station, and enough counter space for supplies. Use reclining medical chairs or zero-gravity chairs for patient comfort during longer infusions. Install IV poles, an infusion pump, and emergency equipment like an oxygen tank, AED, and crash cart. If space allows, having a dedicated infusion nurse workstation inside the room will help streamline care. Once your physical setup is in place, you'll need to make sure your supplies and equipment are on point and compliant with sterile standards. Here's a checklist of essential items: chelating agents sourced from a licensed compounding pharmacy, IV fluids, normal saline or sterile water depending on protocol, IV administration sets, tubing, extension sets, volumetric infusion pumps for controlled dosing, PPE, gloves, masks, alcohol swabs, sterile drapes, sharps containers, biohazard bags, and IV start kits, lab kits for pre- and post-infusion labs, renal function, CBC, metal levels. Keep a restock system in place and designate 1 staff member to inventory supplies weekly. The next piece is arguably the most important: your team. The right clinical staff ensures smooth delivery and keeps patients safe. At minimum, you'll need a licensed prescriber, MD, DO, NP, or PA, to assess patients and order treatments, a registered nurse or RN or licensed vocational nurse, LVN, trained in IV insertion and monitoring, administrative support for scheduling, documentation, and patient follow-up. All clinical staff should be trained in IV chelation protocols, emergency procedures, sterile technique and infection control, how to recognize and report complications. Consider using simulation drills every few months to keep everyone sharp. Now let's look at how you manage patient intake, workflow, and documentation to run this service efficiently. Patient intake. Use a detailed questionnaire to identify exposures, symptoms, and comorbidities. Always get baseline labs before treatment begins. Scheduling. Space infusions based on agent and protocol. Some patients will come weekly, others may come daily for short intensive cycles. Vital monitoring. Check vitals before, during, and after the infusion. Record everything in the chart. Emergency preparedness. Keep crash cart stocked and rehearse code blue protocols every quarter. Documentation. Use EMR templates for chelation-specific informed consent, infusion notes, and lab tracking. Let's recap how to set up a successful chelation service in your clinic. 1. Design a clean, efficient infusion space that supports safety and comfort. 2. Stock up on essential supplies and infusion equipment that meet sterile standards. 3. Train your staff thoroughly in IV therapy, chelation protocols, and emergency response. 4. Build strong systems for patient intake, lab tracking, documentation, and follow-up. In video C3, we'll go even deeper and explore how to maintain quality control, ensure regulatory compliance, and prepare your chelation service for inspection or accreditation. Thanks for joining me. I'm Adam Sewell, MD, and I'll see you in the next video.